You could be weeks away from a massive heart attack and you would have no way of knowing. Your doctor told you your heart is healthy, your cholesterol is normal, your blood pressure looks fine, you passed your stress test, but yet you could still suffer from a major heart attack. I'm Dr. Arpit Patel. I'm a triple board certified cardiologist, and in over a decade of clinical work, the most dangerous cases I have ever seen had one thing in common. The patient felt completely fine right up until the moment they didn't. In the next few minutes, I'm going to walk you through 10 early warning signs of heart disease that most doctors aren't testing for. Hidden warning signs that, according to the science, often identify cardiovascular risk long before symptoms ever develop. If your doctor has ever told you your heart looks fine, I encourage you to watch every one of this. One of the biggest misconceptions I hear is this: if something were wrong with my heart, I would feel it. I wish that were true. The reality is that atherosclerosis, the buildup of plaque inside your arteries, can quietly develop over years, sometimes decades, without causing a single symptom. That's why my philosophy has always been simple. The goal isn't to create fear. The goal is to create awareness, because prevention gives us options that treatment never can. Let's start with the first sign. Sign 1. Elevated ApoB, even when your LDL looked normal. If you have ever looked at your cholesterol report and thought, everything looks okay, this section is for you. Most people have heard of LDL cholesterol. Very few people have heard of ApoB. Yet, ApoB may tell us much more about your cardiovascular risk. Here's why. Think of LDL as the amount of cholesterol being carried. Think of ApoB as the number of delivery trucks carrying that cholesterol. It's the number of particles, not just the amount of cholesterol, that increases the chance of those particles entering the artery wall and contributing to plaque formation. That's why someone can have what appears to be normal LDL cholesterol level while still carrying a much higher burden of atherogenic particles. One patient I'll never forget was a successful executive in his mid-50s. He exercised several days a week. He watched what he ate. He never smoked. Every annual physical ended up with the same reassuring words: everything looks good. His LDL cholesterol was only 98. Many physicians would have been satisfied with that number. But when we looked deeper, his ApoB came back at 142. That immediately changed the conversation. We followed it with a coronary CTA. Despite feeling completely healthy, he already had early plaque developing inside his coronary arteries. He had no chest pain, no shortness of breath, no warning signs. The plaque was silently building long before symptoms ever appeared. The lesson here is simple. Sometimes the number everyone focuses on isn't the number that matters most. That's why I tell my patients, you cannot optimize what you do not measure. If you have family history of heart disease, if you are over 40, if you have been told your cholesterol is fine, ask your physician whether an ApoB measurement is appropriate for you. Sometimes one additional blood test can completely change how we think about cardiovascular risk. Now let's talk about one of the biggest misconceptions in preventive cardiology. One that gives thousands of people false reassurance every year. Sign 2. A calcium score of 0 does not mean you have zero plaque. This surprises almost everyone. A calcium score of 0 is excellent news. It tells us there is no detectable calcified plaque. But here's what it does not tell us. It does not tell us whether you have soft plaque. Soft plaque is often earlier in the disease process. It has not been calcified yet. And in many cases, it's the actual type of plaque most likely to rupture and trigger a heart attack. A calcium score simply cannot see it. I have seen this pattern more often than people realize. One particular patient has stayed with me. He was a pharmacist in his late 40s. He dispensed cardiac medication every day. He understood heart disease. He exercised. His calcium score, 0. His stress test, normal. Everything suggested he was low risk, but something didn't fit. Because of his overall risk profile, we decided to look directly at his coronary arteries with a coronary CTA with plaque analysis. Instead of pristine arteries, he had more than 90% narrowing in his proximal left anterior descending artery, often called the widowmaker artery. He had no symptoms, none. If we had stopped after the calcium score, we would have completely missed it. He underwent urgent cardiac catheterization and successful stent placement. Today, he's doing extremely well on guideline-directed medical therapy. What this taught me was this: normal screening tests don't always mean normal coronary arteries. Every test answers a different clinical question. That's why selecting the right test for the right patient matters. I'm not suggesting everyone needs a coronary CTA, but for the right individual, especially someone with multiple risk factors, it can provide information that no stress test or calcium scare alone can. Because at the end of the day, we are not treating numbers, we are treating people. Here's the interesting part. Sometimes your arteries are trying to tell you something long before they cause chest pain. And one of the earliest clues has nothing to do with chest discomfort at all. Sign 3. Your VO2 max is quietly declining. Imagine two people, both are 52 years old, both run several times each week. One is getting faster, the other slowly becoming a little more winded. Not dramatically, just enough that every run feels slightly harder. Most people blame age, stress, busy schedules, poor sleep. Sometimes that's true, sometimes it isn't. VO2 max measures how efficiently your heart, lungs, blood vessels, and muscles work together to deliver oxygen during exercise. It is one of the strongest predictors of long-term health and longevity. Yet, very few people have ever heard it formally measured. The number on your smartwatch is simply an estimate. One of the most memorable patients I have treated was an avid marathon runner. For years, his training had been remarkably consistent. Then something changed. His pace gradually slowed by nearly third second per mile over 6 months. His primary physician reassured him, "You're just getting older," but he knew his body. Something felt different. We performed a formal VO2 max testing. His aerobic capacity had fallen by approximately 14%. That prompted us to investigate further. A coronary CTA revealed early coronary plaque that hadn't yet caused symptoms. Because we identified it early, we had the opportunity to intervene before it became a crisis. The lesson here is a declining VO2 max isn't always a heart problem, but it should never automatically be dismissed as aging. Your body often whispers long before it screams. Listen to those whispers. If these first three signs sound familiar, don't ignore them. Sometimes one conversation can provide clarity and potentially change the course of your cardiovascular health. If you'd like a personalized assessment of your own risk, there's a link in the description below where you can learn more about working with me. Now let's continue, because the next sign affects millions of people and most have no idea it's happening. Up to this point, we have talked about what's happening inside the arteries. Now let's talk about why those arteries become diseased in the first place. Because plaque doesn't simply appear overnight. It develops over years, influenced by metabolism, blood pressure, inflammation, and body composition. And one of the biggest contributors often goes completely unnoticed. Sign 4. Blood sugar spikes after meals. When most people think about diabetes, they think about a high fasting blood sugar or an elevated hemoglobin A1C. But here is what many people don't realize. Your blood sugar can spike significantly after meals for years before either of those become abnormal. During that time, your body is already under stress. Those repeated glucose spikes can contribute to inflammation, damage the lining of your blood vessels, and promote the development of atherosclerosis. This is why I don't simply ask, "Do you have diabetes?" I ask, "How is your body handling the food you eat every day?" His fasting glucose was normal. His A1C was normal. He exercised regularly. If we had stopped there, we would have concluded everything was fine. But because of his overall risk profile, I recommended an oral glucose tolerance test, or OGTT. For those unfamiliar with this test, you drink a measured glucose solution and your blood sugar is checked over the next 2 hours. It's designed to reveal how efficiently your body processes sugar after a glucose challenge. His fasting glucose looked reassuring, but after the glucose load, his blood sugar rose much higher than expected and stayed elevated longer than it should have. His body was already showing signs of impaired glucose handling long before diabetes would have been diagnosed on routine screening. We also used a continuous glucose monitor for a short period to understand how his everyday meals affected his glucose levels. Instead of adding medication, we focused on nutrition, strength training, improving sleep, increasing daily movement after meals, and reducing highly processed carbohydrates. Over the next several months, his glucose responses improved dramatically. More importantly, we addressed the problem before years of silent vascular damage had accumulated. The lesson here is this: normal fasting blood sugar doesn't always mean normal metabolism. Sometimes the earliest warning signs only appear when your body is challenged. That's why, for patients at higher cardiovascular risk, I often consider additional metabolic testing rather than relying on fasting glucose alone. Because prevention isn't about waiting for diabetes, it's about identifying the process years before the diagnosis. Speaking of silent damage, there's another number that many people are reassured because it's not that high. Unfortunately, our arteries don't always see it the same way. Sign 5. Blood pressure consistently above optimal. Let's clear up one of the biggest misconceptions about blood pressure. Many people think blood pressure is either normal or high. In reality, cardiovascular risk exists on a spectrum. Even mildly elevated blood pressure, especially over many years, increases stress on the arteries. Think about it this way. Your heart beats roughly 100,000 times every single day. With every heartbeat, your arteries experience mechanical stress. When blood pressure remains consistently elevated, that stress gradually damages the blood vessels, causing plaque to develop over time. That's why modern blood pressure guidelines have evolved over the years. The goal isn't simply to avoid extremely high numbers. The goal is to reduce cumulative damage over decades. One patient in particular taught me an important lesson. He was taking 2 medications for blood pressure. Despite that, his readings remained above goal. He exercised almost every day. Interestingly, nearly all of his exercise consisted of high-intensity interval training or HIIT. HIIT is an excellent tool, but like any tool, it has to be used appropriately. After reviewing his overall health, we made several changes. We emphasized nutrition. We improved his sleep. We addressed stress management. Most importantly, we shifted much of his exercise towards zone 2 aerobic training while still incorporating high-intensity work strategically. Within about 3 months, something remarkable happened. His blood pressure steadily improved. With careful physician supervision, we were able to significantly reduce the dose of his blood pressure medications while maintaining excellent blood pressure control. Now, I want to be very clear. I'm not saying everyone can stop their medication. Many people absolutely need them. The goal isn't to avoid medication. The goal is to optimize the underlying physiology whenever possible. Medication and lifestyle are not competing strategies. They're complementary. The lesson here is simple. Don't rely on one blood pressure reading at your doctor's office. Measure it at home. Measure it at different times of the day. Look for trends, not isolated numbers. Your arteries experience your blood pressure 24 hours a day. One reading never tells the whole story. Now let's talk about one of the biggest blind spots I see in active professionals. It's something many people literally can't see in the mirror. Sign 6. High visceral fat despite a normal weight. Have you ever met someone who looks incredibly fit yet always develops diabetes or heart disease? Most people assume they must have gained weight, not necessarily, because the most dangerous fat isn't always the fat you can see. It's the fat surrounding your internal organs. We call this visceral fat. Unlike the fat just beneath your skin, visceral fat is metabolically active. It produces inflammatory chemicals. It contributes to insulin resistance. It affects blood pressure. And it increases cardiovascular risk. The challenge is you can't accurately measure it by looking in the mirror. You can't determine it from your clothing size. And body mass index, BMI, often misses it completely. I've seen this pattern more times than I can count. One of the most memorable patients I cared for was a marathon runner. His BMI was 22. Yet, when we performed a data body composition scan, the results told a completely different story. Despite being lean overall, he had a high amount of visceral fat surrounding his abdominal organs. That finding prompted us to look deeper. His calcium score later revealed significant coronary calcification. Had we relied only on BMI or body weight, we would have missed an important part of his cardiovascular risk. The lesson here is this: your body weight does not tell the whole story. Body composition matters far more than body weight alone. If you have been exercising for years but have never measured your body composition, consider doing it. A DEXA scan takes about 10 minutes. It provides detailed information about muscle mass, body fat percentage, bone density, and visceral fat. When we measure the right thing, we can create far more personalized strategies. Because the goal isn't simply to lose weight. The goal is to become metabolically healthier. So far, we have covered 6 warning signs that often develop quietly over many years. But the next 3 may be even more surprising. One is entirely genetic. One happens while you're asleep, and one often affects highly active people who believe they're in excellent cardiovascular health. Let's keep going. By now, you've probably noticed a pattern. Heart disease rarely develops because of one single problem. It's usually the result of multiple small risks accumulating over many years. The good news, when we identify those risks early, we have an opportunity to change the trajectory before symptoms ever appear. The next warning sign is one that can completely change how we think about someone's cardiovascular risk, and it's something many people have never even heard of. Sign 7. elevated lipoprotein, the genetic risk factor most people never test. Let me ask you a question. Have you ever known someone who exercised regularly, ate well, had cholesterol that looked reasonable, and still had a heart attack in their 40s or 50s? Most people assume there must have been something they missed. Sometimes there was. Sometimes it was lipoprotein A or LPA. LPA is genetically determined cholesterol particle that's inherited from your parents. Unlike LDL cholesterol, which often improves with diet, exercise, and medication, LPA is largely determined by genetics. That means you can live an incredibly healthy lifestyle and still have genetically elevated LPA. The encouraging news is that you only need to measure it once in your lifetime because your level remains relatively stable. One patient I'll never forget was a physician in his 40s. He exercised, he maintained an excellent weight. His LDL cholesterol was exceptionally low because he had been aggressive about prevention. Yet, his LPA level came back dramatically elevated. Further evaluation revealed significant coronary artery disease despite what most people would have considered excellent cholesterol control. That single blood test completely changed our strategy. Instead of assuming his low LDL meant low risk, we became much more proactive with every other modifiable cardiovascular risk factor. The lesson here is this: you can't change the genes you inherited, but you can change how aggressively you manage everything else. If you have a family history of premature heart disease, if a close relative had a heart attack or stroke at a young age, or if someone in your family developed cardiovascular disease despite normal cholesterol, ask your physician whether an LPA test is appropriate. Sometimes understanding your genetics gives you the opportunity to protect your future. Now let's move from genetics to something every single one of us does every night, or at least we are supposed to. Sign 8. Consistently poor sleep. If I told you there was one thing that influenced your blood pressure, your blood sugar, your inflammation, your recovery, your hormone, and even your cardiovascular risk, you're probably expected to be an expensive medication. It's not. It's sleep. Sleep isn't simply the time when your body shuts off. It's when your cardiovascular system repairs itself. Your blood pressure naturally falls. Your heart rate slows. Your nervous system resets. Inflammation decreases. Your body performs maintenance that simply cannot happen while you're awake. I have had conversations with busy executives and entrepreneurs who proudly tell me, "Doctor, I only need 5 hours of sleep." My response is always the same. You may have adapted to functioning on 5 hours, but that doesn't necessarily mean your body has. Research has consistently shown that chronically insufficient sleep is associated with higher rates of hypertension, diabetes, obesity, atrial fibrillation, and cardiovascular disease. What's fascinating is that the effects are often silent. You don't wake up one morning and suddenly feel your arteries aging. It happens gradually. One patient in particular taught me this lesson. He had optimized almost everything. His nutrition was excellent. His exercise consistently. His cholesterol looked great. Yet one area getting overlooked: sleep. He averaged less than 6 hours per night for years because he believed productivity required sacrifice. When we reviewed his variable data together, the pattern was obvious: poor sleep, elevated resting heart rate, reduced heart rate variability, slow recovery after exercise. Together, we focused on improving sleep hygiene, not perfection, just consistency. Earlier bedtime, reducing evening screen exposure, limiting late night alcohol, creating a predictable sleep schedule. Within months, his recovery improved, his energy improved, his exercise capacity improved. Most importantly, he finally appreciated that sleep wasn't stealing time from his life. It was helping protect the years ahead. The lesson here is simple. Don't think of sleep as lost productivity. Think of it as one of the highest return on investments you can make in your long-term health. Because no amount of exercise or healthy eating can completely compensate for chronically inadequate sleep. Speaking of exercise, there is one warning sign I never ignore, especially in people who consider themselves healthy. Sign 9. Decline in exercise tolerance without an explanation. And ironically, it's one that active people often dismiss. Here's what I mean. If climbing a flight of stairs suddenly feels harder, if your cycling pace keeps falling, if your running times continue getting slower, if your recovery between workouts takes much longer than it used to, don't dramatically assume it's just age. Could it be aging? Absolutely. Could it be overtraining? Of course. But it could also be your cardiovascular system asking for attention. One of the most memorable patients I have treated was an accomplished triathlete in her early 50s. For nearly a year and a half, she watched her race performance slowly decline. She did what many athletes do. She trained harder. She increased mileage. She pushed through fatigue. Several evaluations suggested she was simply overtraining. But something about her story didn't sit right with me. So we stepped back and looked at the bigger picture. Formal VO2 max testing confirmed that her aerobic capacity had fallen significantly. That prompted us to obtain a coronary CTA. The scan reveals early soft plaque involving two coronary arteries. She wasn't having chest pain. She wasn't having classic symptoms. Her first clue was simply that her body wasn't performing the way it once had. Because we found it early, we were able to intervene before she experienced a major cardiovascular event. What this case reinforced for me was this: your body is incredibly intelligent. Performance often begins declining long before disease announces itself with symptoms. Listen when your body starts changing. Not every decrease in exercise tolerance is heart disease, but every unexplained decline deserves an explanation. That's why I encourage my patients to pay attention to trends, not just how they feel today, but how they compare to themselves 6 months ago or a year ago. Because your greatest comparison isn't someone else, it's the healthiest version of yourself. How fast is your body actually aging? Because your calendar tells you how many birthdays you have celebrated, it doesn't tell you how healthy those years have been. Let's finish with one of the most fascinating developments in longevity medicine. We have covered cholesterol, we have talked about blood pressure, blood sugar, sleep, fitness, genetics, body composition, and imaging. You may be wondering, how do all of these pieces fit together? The answer is simple. They're all trying to answer one question. How healthy are you? Really? Not how healthy you look, not how healthy you feel, but what's actually happening beneath the surface. That brings us to the final sign. Sign 10. Your biological age is older than your chronological age. Most of us celebrate birthdays by counting another year on the calendar, but your cells don't read calendars. Your arteries don't know whether you're 45 or 55. They respond to how they have lived. Your sleep, your nutrition, your exercise, stress, smoking, inflammation, metabolic health, those factors influence how quickly your body ages. This is where the concept of biological age becomes so interesting. Chronological age is simply the number of years you have been alive. Biological age estimates how your body is aging based on measurable biological changes. Think of it this way. Imagine two people who are both 50 years old. One has a cardiovascular system of someone much younger. The other has arteries that resemble someone years older. Same birthday, very different biology. One patient in particular taught me just how powerful this information can be. He was 48 years old, successful, busy, no major symptoms. He exercised when he could. He assumed he was doing reasonably well. When we completed his comprehensive evaluation, something stood out. His biological age measured approximately 56 years. His fitness age was also significantly older than expected. Nothing in his annual physical had suggested this. No one had ever measured it before. The results didn't mean he was destined to become ill. Quite the opposite. They gave us something incredibly valuable, a starting point. We built a personalized plan around nutrition, exercise, sleep, stress management, and cardiovascular risk reduction. Because once you establish a baseline, you can begin tracking progress. You're no longer guessing whether your efforts are working. You're measuring them. The lesson here is this: information isn't something to fear. It's something that empowers you. The earlier you understand what's happening inside your body, the more opportunities you have to change its future. If you have watched this far, you've probably noticed something. None of these warning signs are really about finding disease. They're about finding opportunity. Opportunity to intervene earlier. Opportunity to personalize care. Opportunity to protect your future rather than simply reacting to problems after they appear. Over the years, I have cared for patients from every walk of life. Executives, business owners, physicians, athletes, parents, grandparents. One thing they have all had in common is this: almost every one of them wished they had known sooner. No one has ever told me, I wish I had waited until my first heart attack. That's why I believe prevention is one of the greatest gifts modern medicine can offer. Not because it guarantees perfection, nothing in medicine does, but because it gives us choices. And choices are the most powerful before disease limits them. People often ask me what preventive cardiology really means. For me, it's actually quite simple. It's recognizing the feeling healthy doesn't always mean you're healthy. It's understanding that the absence of symptoms doesn't necessarily mean absence of disease. It's believing that prevention is more powerful than treatment. It's appreciating that health span matters just as much as lifespan, because living longer only matters if you're healthy enough to enjoy those extra years. I don't want my patients simply to live into their 80s or 90s. I want them hiking with their grandchildren, traveling, building businesses, playing golf, running races, celebrating anniversaries, doing the things they have spent decades working so hard to achieve. That's what health is really about. I have always believed that ultimate luxury isn't another car, another promotion, or another vacation. The ultimate luxury is having the health to enjoy the life you have worked so hard to build. And that's why I dedicate my career to prevention. Not because I'm trying to help people avoid disease, because I'm trying to help them preserve the life that disease can quietly take away. If today's video has done something, I hope it has changed the way you think about your heart. Maybe you have recognized one of those warning signs. Maybe you realize there are questions no one has ever answered for you. Or maybe you simply want to understand your own cardiovascular risk with greater clarity. Remember, the goal isn't to create fear. The goal is to replace uncertainty with knowledge. Because once you understand where you are, you can build a plan for where you want to go. And so those are the 10 signs. None of them show up on a standard annual physical. By the time symptoms appear, the disease has already been building inside you for years. That's the gap I'm here to close. If you're a high-performing professional and you want to know exactly what's happening inside your body and not just a guess, the link to my website is in the description below where you can book a consultation. If this video taught you something new, do two things. Subscribe to this channel so the next one finds you, and send this to the one person you care about. It might be the most important thing they watch this year. I'm Dr. Arpit Patel, and thank you for watching.